Inspection of the oral cavity. Oral cavity is the beginning part of gastrointestinal tract and like mirror of disease of gastrointestinal tract. So before inspection of gastrointestinal tracts and digestive organs, we should firstly inspect oral cavity. Well, you should ask patient to show his tongue and mouth cavity. Please show me your tongue. As we can see, tongue is wet, is pink, and slightly white layer at the basic of a tongue, and papillary layer is okay, and no other changes we can identify at this patient. For patient, it is quite difficult to keep tongue outside long time. So if you have not checked all things, did not provide all inspection by first time, you should give patient some rest and then repeat inspection. Then you can check teeth. Please open your mouth. Okay. So we can see that teeth are okay. It's like normal. Some caries changes, but not clinically significant. Then you should press on gum, but by the skin, through the skin, to identify bleeding from gum. So there is no bleeding from gum because due to mechanical irritation, bleeding will increase, but no bleeding in this case. Next step is evaluation of oral mucosa. You should check oral mucosa. It should be pink, it should be wet, and check the changes of color. It can be yellowish due to jaundice, for example. Also during this step you should check and evaluate tonsillar gland. Next you should visually check inner surface of cheeks. It should be also clean and pink color and wet. Then you should check scleros color. It can be changed due to different disease like jaundice and so on. Next chapter is inspection of abdomen. Inspection of abdomen we can provide in laying or staying position of the patient. But more information we can receive in laying position of the patient. Firstly, we should check does abdomen take part into breathing. Normally it should take part in breathing process. Then we should estimate shape of abdomen. We can see normal shape of abdomen. Also, we cannot see collateral vessels on the surface of abdomen. Collateral vessels can occur in case of hypertension in portal system. Next, we should check presence of post-operative or traumatic scars on surface of abdomen. Then you should check presence of spot of pigmentation and spots of hyperemia on the surface of abdomen. Next step is to check stretch marks. Stretch marks can be in men and in women, and can be due to different disease, pregnancy, some hormonal changes, and so on. In this case, we cannot see any stretch marks. Next step is visual inspection of deformation of abdomen and presence of hernias. In this case, we cannot see any changes and any hernias. For better identifying of hernias, we should increase pressure inside of abdomen. How we can do it? We can ask patient to press his abdomen muscles, like this you can see. Or we can ask patient to cough. Cough, please. As you can see, no hernias occur during pressing of muscles and during cough. Next chapter is percussion of abdomen. Percussion and auscultation is less informative method of examination comparing with palpation. During percussion of abdomen in the area of stomach projection, we can hear a low tympanic sound.
Низький тимпаніт.
Percussion of intestines give us high tympanic sound.
Високий тимпаніт.
Obligatory, you should check hepatic dullness presence. It is very important because absence of hepatic dullness can be in case of pneumoperitoneum. It's serious disease. Also, by percussion, we can identify fluid into abdominal cavity. Clinical founds depend on amount of the fluid. In case of low amount of fluid, fluid only accumulated in the lateral sides of abdomen and never reach the pubic area of abdomen. For identification a low amount of fluid, you should provide percussion from the center of abdomen till the lateral part. Like this. If normally in this area should be tympanic sound, but if you find dullness in lateral area only in one side of abdomen, it is not clinically significant. In this case, you should check. You should provide percussion at opposite side of abdomen, at the left side. And if you found dullness in this area also, it's like a very important symptom which can identify presence of liquid. How to be sure that it's really liquid in abdominal cavity and no other disease or changes in abdominal cavity? You should ask patient to lie into one side, left or right, and provide percussion in such way how you can see on video. So you should percutate from lateral part, cross the central area of abdomen till opposite part. And if you found tympanic sound at the beginning of investigation in place where is previously you have found dullness, it means that fluid just move to another side of abdomen due to gravity. Another method of identification of a low amount of fluid is the next. You should percutate as previous time from the center of abdomen till lateral part. You will find dullness in lateral part. Then you should percutate from central part of abdomen till pubic area, and at pubic area you will receive tympanic sound. Then you should ask patient to stand up or sit up and percutate again from the center of abdomen till pubic area. And according to gravity, fluid should move into pubic area. And in this case, in case of presence of low amount of fluid, in sitting or in staying position of the patient, you will find dullness under the pubic area of abdomen. In case of big amount of fluid in abdominal cavity, during visual inspection you will see increased size of abdomen, but increased size of abdomen is not obvious sign of liquid into abdominal cavity. It can be due to meteorism or due to obesity. Identification of big amount fluid in abdominal cavity we provide by identification of a fluctuation symptom. How to provide it? One hand you should locate into one lateral side of abdomen, but by another hand you should slightly beat surface of abdominal cavity. For excluding vibration of abdominal wall, you should ask patient to locate his hand at the center of abdomen, like you can see on video. Now you can see a negative symptom of fluctuation. Next chapter, auscultation of abdomen. During auscultation, we can identify intestinal sounds and peritoneal friction. You should auscultate abdomen in different places. In healthy person, after a few hours after meal, we can identify some intestinal sound. It's like normal sound, especially in right iliac area. There are a few types of intestinal sounds. It can be bubbling, it can be fluid movement, or something like that. Absence of intestinal sounds is a sign of intestinal paresis. After surgical, after trauma, after some diseases. Next chapter, superficial palpation of abdomen. Superficial palpation of abdomen you should provide into lying position of the patient. Patient should be freely lying at the bed. Legs should be free and should be parallel. During superficial palpation of abdomen, you should obviously take into account emotion of the patient, mimic of the patient. Before superficial palpation, you should obviously ask patient about feeling of pain anywhere in abdomen. In this case, you should ask where is this pain is located. And then you should start palpation from opposite area to the pain. In case of absence of pain, you should start palpation from regio iliaca sinistra. You should place your hand according to video. It is good practice to provide palpation by large and small circle. What you should identify during superficial palpation: is any area painful or not? Is surface of abdomen soft or rigid? Resistance and defense. Then you should move across the circle. Then you should move across all topographical areas of abdomen by large and small cycle, like you can see on this video. Now you should check the small circle. At the end of superficial palpation of the abdomen, you should place your finger along white linea of abdomen, linea alba abdominis. Then you should ask patient to cough and move your hand lower and ask patient to cough again. Previously there was identification of hernias by visual inspection. Now we have checked presence of hernia by palpation. When you have finished palpation in all topographic area of abdomen, you should start identification of symptom of irritation of peritoneum. Most commonly used is Schottky-Blumberg symptom. How to do it? You should dip your hand into abdominal cavity and suddenly release, and ask patient if patient feels some pain. Let's start to do it. Dip your hand inside and suddenly release. Moreover, you should check Schottky-Blumberg symptom in all topographic area of abdomen. And don't forget to ask patient about pain. Next chapter, deep sliding methodical topographic palpation. We start deep sliding palpation from sigmoid colon. For palpation of colon, you should follow the 4 steps. There are first steps. First step is correct topographical setting of your hand. For sigmoid colon palpation, first of all, you should identify linea spina umbilicalis. You should divide distance between navel and spina iliaca anterior. Projection of sigmoid colon is located between outer and median 1/3 of linea ilioumbilicalis. You should place your hand in this point. You should use ulnar margin of your hand to set up in this location. And now you should provide second step, formation of a skin fold towards the navel. Third step, dip inside your hand during each exhalation. You should do it gradually. And last step is fourth step is sliding movement of the hand in the direction opposite to formation of a skin fold. Another method of palpation of sigmoid colon is by 4 fingers, as you can see on video. There are 4 similar steps. First step is position of the hand in the right topographical area. Second step is formation of skin fold. Third step, movement inside by gradually dipping inside during exhalation. And fourth step is sliding movement across the sigmoid colon. Third method of palpation of sigmoid is also by 4 fingers, but from opposite side of patient. Palpation of cecum. There are also 4 steps. Cecum is located between outer and median 1/3 of linea ilioumbilicalis dextra. First step is correct location. You should use 4 fingers, slightly flexed, forming a line of palpation. Second step is forming skin fold. And start dipping inside during each exhalation. And last step, sliding movement across the cecum. Now I will show you fast performing of deep sliding palpation of cecum. Palpation of the ascending colon. You should use two hands for palpation of this part of colon. One hand should be like basis for another hand. Second hand is active palpating hand. Projection of colon ascendens starts from point which is located between outer and median 1/3 of linea ilio-umbilicalis and goes upside along musculus rectus abdominis. First step is correct setting of hands. You should use 4 fingers by one line. Second step is formation of a skin fold. Third step is gradually dipping inside during exhalation. And last step, sliding movement across the colon ascendens. Repeat again. First step, second step, third step, and fourth step. Palpation of the descending colon. Also should be provided by two hands. One hand is the basis for another hand, and second hand is active palpating hand. There are two ways of formation of the basis. First variant, you can formate basis under the patient, and second way is to formate in basis above the patient. First steps is correct location of the hand. You should again find a linea ilio-umbilicalis and divide into 3 parts, and you should find point between outer and middle part of this linea, and goes upside from this point. While first step is putting hands into this line. Second step is formation of skin fold. Third step, dipping inside during exhalation. And fourth step, sliding movement across the descending colon. I repeat. Percussion of liver. There are two methods of liver percussion. First method includes identifying of 5 points and 3 sizes. The advantages of this method are the ability to determine the size of the left lobe of the liver. First point is located on linea medioclavicularis dextra. Let's start percussion. Here we find first point. Second point is also located on this line, but we should start percussion from bottom to top. You should percutate till dullness. Third point is horizontal projection of point number 1 on linea mediana anterior, because there is no sense to percutate in this area due to close location of solid organs like heart and mediastinum. Fourth point should be identified by percussion. You should start percussion by linea mediana anterior from bottom and goes upside.
До тупості.
You should percutate till dullness. Fifth point is determined by percussion along the edge of the left costal arch. Now we have three dimensions. What are they? First dimension, it's between fifth and third points. Average size of this dimension is about 7 centimeters. Second dimension, between third and fourth point. Average size about 8 centimeters. Third dimension, between first and second points. Average size about 9 centimeters. Each size can be 1 centimeters plus minus. Second method of liver percussion. Second method includes percussion by 3 lines on the chest and by 5 lines on abdomen. On the chest we should start from linea parasternalis dextra. Second line is linea media clavicularis. We should also percutate till dullness. And last line on the chest is linea axillaris anterior dextra. Then we should provide percussion by these 3 lines, but on abdomen.
Йдемо до тупості.
There are 2 additional lines for percussion on abdomen. There are linea mediana anterior and linea parasternalis sinistra. As a result, we have 3 sizes between paired points. First dimension between points on linea parasternalis dextra. The dimension is average 8 centimeters. The dimension on media clavicularis line is about 10 centimeters, and dimension by linea axillaris anterior is about 12 centimeters. Palpation of liver. You should place patient's right hand on his or her chest due to decrease breathing movement of the chest. Before palpation of liver, you should firstly identify the lower body of liver by percussion. It is enough to provide it only by 1 line. For liver palpation, you also need 2 hands. For palpation of liver and spleen and kidney, you need the same steps like palpation of colon, except folding formation step. Well, we need only 3 steps. Let's start. First of all, you should fixate chest by 1 hand. You should use 4 fingers on active palpating hand. Linea media clavicularis should divide your hand into similar part. You should locate your active hand 2 or 3 centimeters lower the border which you have found during percussion. This is first step. Second step is dipping inside during expiration. Just remind you, skin fold is not formed. And third step, sliding movement. But comparing with colon palpation, there is no movement of hand. A liver should move below your hand during breathing. Inspection of spleen. Percussion of spleen can be provided on laying position on the back, on the right side, and on the diagonal position of the patient. In case of right side or diagonal position of the patient should flex his left leg for relaxing musculus psoas sinistra. Percussion of spleen. The aim of spleen percussion is a topographical location of spleen. Spleen is normally located retroperitoneally, and projection of 10 ribs divide spleen into similar part. Let's count ribs. We have found 10 ribs, which divide spleen into 2 parts. Percussion we should start from the back and move by 10th rib till dullness. Then start from abdomen. Then, by perpendicular line to the 10th ribs, you should identify width of the spleen. Well, the length of the spleen is about 6 centimeters and width is 4 centimeters. Palpation of spleen. Palpation of spleen is provided in position patient on the back, on right side, or in diagonal position. You should find again 10th rib. So you should use bimanual palpation of spleen. First step is a fixation of chest by left hand. You should use 4 fingers of right hand. You should place right hand below the left costal arch. Then you should move inside during expiration. And then you should ask patient to deeply breathe, and spleen will be sliding below your hand. Your hand should be fixed or stable. Palpation of kidneys. Before palpation of kidney, you should identify Pasternacko's symptom. Pasternacko's symptom should be checked in sitting position of the patient. You should remember anatomy that 12 ribs divide left kidney into 2 parts, and on the right side divide kidney into 3 parts and located between middle and upper part of the kidney. You should place your one hand into the back in the projection of 12th rib and slightly beat by another hand. And you should do the same at the other side. Then you should ask patient, is it painful or not? If not, it means that Pasternacko's symptom is negative. Palpation of kidney should be provided by manual, and both of the hands are active. Left hand should be placed under the patient. You can fix your elbow on your knee. It will be more comfortable for you to provide palpation of kidney. Fingers of left hand should be near the spinal column. Right hand is placed on the abdomen, slightly below the right costal arch. Then we start active palpation of kidney. What does it mean? It means that left hand moves to the right hand together, to each other, for better understanding of organ. Then you should ask patient to deeply breathe. And kidney slide between two hands. You can feel it. Palpation of left kidney is the same. You should place left hand under the patient and your wrist should be at the projection of spinal column. Right hand should be placed at the edge of musculus rectus abdominis, slightly below left costal arch. Then you should move both your hands to each other and ask patient to breathe. Normally, kidney should not be palpatable.